how to properly examine a dog. Now, when you examine a dog, there's a lot of many things that you have to keep in mind. One, what's the dog's history? Have they been sick? Have they had any kind of diseases that you might need to know? Certain things like that. My demonstration-ee right here is Tater. He's my dog. He's 4 years old. And as you can tell, he's very used to these types of exams. Now, the first thing you want to do when you try to give your dog the examination that they would receive at a veterinarian office is see if they're comfortable. Because if they're not comfortable with you, you can't expect them to be comfortable with anybody else. I think he seems pretty comfortable right now. Now, the first thing that we're going to check is his eyes. And what you do is you put one leg behind them so they don't try and run away from you, because that's never good. And you just gently open his eye like that. And you try to make sure that there's not really much redness or nastiness in his eye. He doesn't like this. Next, you want to check their ears. The reason why you want to check their ears is because dogs, especially dogs with floppy ears, are very prone to getting yeast infections and ear mites. Any dog can really get ear mites, but it happens mostly with dogs who have closed ears, and yeast infections happen mostly because the moisture is trapped inside of their ear and it can't escape, therefore causing a little bacteria we know as yeast. And when they have a yeast infection in their ear, you'll know it. You can smell it. It stinks. It's gross. And so you just gently pull their head over here and you pull back their ear. You see how his ear is a nice pink color? That's usually how you want your dog's ears to look. If they're super white, you might want to go take them to the vet just to make sure that they don't have any protein deficiencies or something like that. Now you see how his ear right here is a little red? This is because he just had an ear infection. And so we just got done treating it. Ear infections, they usually start out that red, and then they grow to be about the color of her shirt. They can get really nasty really quick. So you always want to make sure you check your dog's ears. Otherwise, it can cause hearing loss. They can try and scratch their ear off. Things like that. It's really important to check. The next thing you want to check is their teeth. You want to check to see if they have any, severe tartar buildup. Now, see, he has a little bit of tartar buildup. Usually with dogs like that, you always want to take them to the vet and get a dental done. It's also really good to brush their teeth. I know it's hard to brush a dog's teeth, but it's really good to actually try and do that to your dogs, because they can get the same diseases that people can get, like gingivitis and stuff like that. Sometimes you also always want to look for is broken or chipped off teeth. This can cause, just like y'all, an infection inside your mouth. They can abscess, cause severe health problems. And you don't want your breath to walk around in pain all the time. I mean, they're your family member. Okay, next, you want to check their pulse. Now, usually with their pulse, if you don't have a stethoscope, you usually want to take it up in their armpit because it's direct to their heart and it has a strong, steady beat. Now, with their pulse, what you want to listen for is any heart murmurs, anything that sounds abnormal. Like right now, his heart's beating a little fast because he's not really excited with what I'm doing to him right now. Okay. His pulse is 95/30. So naturally, when you do that, you always want to put it in a minute. So you multiply that by 2, and then you have your minute. A really low pulse would be like 20/30. That's really low, and it's very dangerous, and you really want to go get them checked out for that. A really high pulse is like 175/30. With dogs like that, you have a risk of having heart attacks, or their heart could potentially explode because of how fast it's beating. Next, I'm going to need my little assistant over here to please help me. Eric. Okay. And I'm going to need you to stand that way. Okay. Next, what you do is you palpate his stomach. Generally, what this consists of is you push on his abdomen right here. You check to see if there's any lumps, anything that feels hard. You always want to check to make sure that they don't have like built up gas, built up fecal. That can usually mean that they're either one, constipated, or two, they have something blocked. They have a blockage. And blockage, that can come from them eating a sock, them eating a plastic bag. If they have blockage, it can be really fatal to them because they can't get anything out of their system. Okay. The next thing you want to do is you want to check his joints. And simply, you just pick up his leg, bring it up like that. He's not yelping, so we know he's okay. You pull it out like that. He's not yelping, so he's okay. He's not pulling on it too much to bring it back to me. I'm going to go to the next slide. When you do this, you're generally looking for signs of arthritis. See, now he has arthritis in his back right leg. That is why he's tugging on it so much when I mess with it. Another thing, they can have tendinitis. They can also obtain a bone disease, which makes it really hard for them to walk. And you always want to check their front and back legs. Now, other than his back right hip, Tater's a very healthy dog. He's a very spoiled dog, and he's a happy dog. When you do these general exercises with these dogs, you don't always want to take them to the vet just because, they're acting a little funny. They have a stomach ache. I hope that this examination helps to show y'all the proper ways to examine your dog to help save you money and also keep your dog happy and healthy.